mental health is such an important leveler for us all, something that very much affects us all. And we can see that it's something that is close to a lot of people's hearts, because we all tend to know somebody who might have that. And so I'm just going to cover it in a more broad sense. And I know that you have this series for the whole year. And I was also, very much wanting to talk about why it's everybody's business, because it is indeed everybody's business. And what I was thinking here in terms of a global perspective, mental health disorders like depression, that we were talking about a little bit about, anxiety, post-traumatic stress disorder, they affect hundreds of millions of people worldwide, which means there are no borders to it. It's not something that just keeps to one country, one particular boundary, one particular family. It's something that is actually universal around the globe for us all. In certainly some things can exacerbate. So we've got crisis and stressors that can actually make it worse. We had that small global pandemic not too long ago now. And that very much caused a lot of angst, a lot of stress. And actually, certainly in the UK, we seen a surge of mental health conditions since we had the coronavirus. There's obviously things like wars, poverty, displacement, climate change, all of these things having an impact collectively on the mental well-being. As was shared before, you can kind of, because we're now a global community, we can feel these stresses rippling out. And the ripple is felt in families, in communities, in entire nations. And why would we actually try and do anything? Well, there's very much the human factor. It's the right thing to do to help each other. And I know that I'm in very good company right here with everyone with the Ecocivilisation, where we connect people who care. Humanity should be a key part of our communities, something that helps bind us together. There's also an economical factor for those who aren't swayed by just the human and humane factor, and that's the economics of it. There is actually an economical side as well. There's some social as well as economical consequences for us all. So loss of productivity, for me, it's very obvious, but it sometimes feels a bit cold. So for anyone who has a mental illness, please do not think that I am saying this heartlessly. This is just to give a balance of the aspects from this perspective as well. Mental illness is a leading cause of disability and absenteeism from work. So it's the top thing. So of course that's going to have an impact on us individually, the person who might be off sick, but also on the teams and also on the work that we were trying to do. That doesn't mean you shouldn't go off sick if you need help, absolutely. But there is therefore still an economical impact. There is the healthcare burden, especially in low and middle income countries, that it can, stretch resources. If they're already a bit creaking at the seams, it can stretch them a little bit further, as does any increase in demand. It's certainly something in UK we are trying very much to get on top of, but obviously it stretched what were our existing mental health resources even further. Accessibility. If we look at it from a global perspective, lack of access to mental health care is actually a form of inequality. Something that, as I point out, is that something is very close to my heart, is addressing inequality in its many forms. And actually lack of access is very much one of them. But let's not forget that it's not always declared. And we'll talk a bit more than that in a minute. And I just wanted people to take a second and think about, is the access to mental health care equitable where you are? Does it depend where you live? Does it depend how rich your country is? Does it depend how rich you are. Is there a shared healthcare system, or is it a paid healthcare system? Or is actually it something your family doesn't believe exists? It's a non-issue that actually it's deemed difficult. So is it equitable where you are? It's very much compounded by a number of factors. So people with mental health illnesses often face discrimination and exclusion. The stigma and the lack of awareness can be really very heavy burden. And that's no wonder why there is fear of actually disclosing it. And this can lead to underdiagnosis and then it undertreated. We had some very passionate pleas about going to get support from qualified professionals. And actually, sometimes people hold back because of all these stigmas that we have from our neighbours, from our friends, from our family, from our employers, for our fear of our jobs. It's also compounded by, and I think more and more is what I see, and this is me more as a nursing clinician, the increase in isolation. It's literally heartbreaking. I have been into patients' houses where one lady definitely had a mental health issue. She had a hall with a couple of rooms off either side, but she was in a chair living in the hall. I was asked to go in to help with her bandages, which is what I did. But that's because her son once came and said he would come back to collect her and she would live with him. When asking her, this was a couple of years ago. But obviously that ideology, that hope was something she very much hung on to, and it caused her not to actually live in any of the flat, but actually live in the hallway. That's very much somebody who's isolation, but also suffering very much from some some mental unwellness there, definitely. And we just have increased isolation with we have increased connectivity, maybe in technology, but not with the human factor necessarily, and that can cause issues. And you might say, why bother? Is it really so common? How prevalent is it really? Well, I thought it'd be useful to have a little look at this from a global perspective. Depression has a global prevalence of over 280 million. It's the leading cause of disability worldwide. Anxiety disorders, 301 million, often co-occur with depression. Bipolar is significantly less, but it's still 40 million people with chronic, with mood swings between highs and lows. Schizophrenia is 24 million, and that affects about 1 in 300. Eating disorders, 14 million, especially prevalent in adolescents. And dementia with 55 million, and that's expected to rise with an aging population. In fact, when we look at the prevalence, it's 1 in 8 people. And if you look in a room, maybe where you're sitting, or when you're going to the supermarket, or when you're in the office, when you're going to work, or at university, wherever you are right now, at some point when you go around and you see that 1 of 8 people will be having a struggle of some description, that is quite a staggering statistic. Mental health disorders account for 15% of the global burden of disease in people aged between 10 and 49. I certainly know that in the UK, the most stressed cohort is our young people. And I think it's very much connected to these smartphones or other controlling devices. I don't know, that's a whole different debate. But it's very much connected to that. But I am still a believer in connection. I'm caring. You're on this call today. You're with me. You're caring too. I think we have hope. We can together reduce the stigma. We are part of a community, and many communities, more than one. And we can influence how things are talked about, how things are shared, what compassion we show each other, and even ourselves. Sometimes The harshest critic I ever meet when I'm supporting my neurodivergent communities is themselves. And that's because sometimes the stigma and criticism can be internalized, and that stays with them for a lot longer. So it's about compassion inside and out. It's about community, as I've said, and services, obviously. Having access to different services, addressing our inequality where we can. Organizations like this wonderful organization hosting this today, and other organizations, which can very much still make a difference. We collectively can all make a difference. And within an organization, that's a hell of a lot of power with us standing side by side together. We can actually try and address the status quo. Look at policy changes. That's certainly something that I want to look at, is see where are the opportunities for policy changes. And that's something that I would want to do as the England lead for the G100 wing, to actually look at what impacts I can make to help my fellow countrymen. And so together, I very strongly think we are stronger. There is a lot to play for. There's a lot to live for. There's a lot that can make a difference. We can look outside our bubble for just one moment. We will look and be able to touch and feel and support each other. I think together we are healthier as well as being stronger.
Thank you so much, Helen. Wonderful words. And you touched upon some of the very significant words through your slide, hope, where you talked about empathy, you talked about stigma. And stigma is again such a crucial thing to address in sessions like these. And I often feel, and this leads me to ask you a question. In the field of psychiatry, I have seen that every time a patient who is suffering, the person who is suffering, is referred to as a patient, even in front of doctors, nurses, everybody. Because if the doctor is making staff explaining something, every time the doctor is referring to that person, patient. And and actually, I think subconsciously, and you are into this profession, you have more ability, capacity to understand the impact of words like these. Do you think there should be some other alternative word to address those people who have already undergone some trauma? There should be some better terminology rather than calling them
Yeah.
patients.
It's interesting because in healthcare, like we could, yes, we do use the word patients quite well, about where if you worked in social care, they say clients. It's so even within the two public sectors, there's different views of it. I do think that the power dynamics are loaded. Actually, when you go to seek help, it's automatically loaded straight off. I think there's quite a lot of institutionalized approaches that actually sometimes encourage a medicalized model, not decourage. There's something very much, for example, in hospitals, like how people, I'm not saying they're not sick, but go more into the sick role. So, for example, get the pajamas out and stuff. There seems to be a certain way of being, and I think that it's not always challenged in a more empowering way. But I think that the moment that you go and see somebody, the power dynamics are different because you're actually seeking help. Could you use a different word? Yeah, definitely. I think you could. Um, and I guess when I do my own work with my coaching and group coaching, we just call each other by our name. Funny enough, it's not a. I don't really. At the end of the day, I'm quite simple. I say if what I'm offering can help you, whether you are neurodivergently aligned, a maybe or a diagnosis, then come. Because my whole point of the not-for-profit is to help people. So for me, it's about one person helping another person with what their particular skill set is. But then, I've always been a person, even when I was lead nurse and elderly care and stuff like that, you know, when the most important person in my team is the cleaner. You know, they're stopping the infection, they're keeping it all okay from the, you know, everything is needed to be healthy. And, you know, and I don't see a higher, even though there is a hierarchy in my head, it's we all got different roles to do. So yeah, that's my particular paradigm that I come from. Yeah.
Right. So